Dr. Dr. Kevin Kavanagh. And Dr. Kavanagh was a regular guest before COVID hit anyway, but he's a retired physician, by the way, and founder of a national organization, quickly becoming an international organization called Health Watch USA. Dr. K, good morning.
Good morning, Jack.
We started this regular thing in, was it February or March last year when COVID first hit?
That's correct. It was about in March.
Okay. And I called you and I said, could you do this 3 days a week for maybe as much as a month? I think I said a month, maybe 2 weeks. I don't know. And you said, sure. Yeah. You said, sure. And the 2 weeks became 2 months, that became a year, and all going on 2 years. I mean, it's really, nobody could have predicted how this works. But anyway, I want to let you guys know that Dr. K is going to take a little time off, probably as much as a month, and I'm going to miss you.
Well, I'll miss myself too, Jack. I'll be honest with you. As you know, it's not a voluntary vacation. I'm getting some healthcare issues kind of tuned up, and I at least have a good speaker, I think, next week and the week after that to fill my slot on COVID-19. And maybe after that, I'll be able to join. Don't know. We'll just see how things go.
Well, we wish you great luck and hope you get back to us quickly. A thought occurred to me the other day, and I want you to, for the first however many years you've been coming in here, and a big focus of Health Watch was diseases that you catch in healthcare facilities, doctors' offices, hospitals, and I'm thinking things like MRSA and C. diff, and I know that was, C. diff almost took my mom out at one time a number of years ago. And, you know, we talked about that for a long, long time when you were on the show. I haven't heard one word about it since COVID. Is that just because we're so focused on COVID, we're not talking about that? Or have these things haven't gone away, have they?
No, they haven't. And the data we have so far, I believe they've gotten a bit worse in facilities. Of course, they're stretched very thin. There's a problem with reporting. I mean, we don't have enough staff to take care of patients now. They're mobilizing the National Guard. How do you start to have reporting for all these different organisms and the time that the staff have to spend to make the reports? So there has been decrease in reporting and some holes in the data, but they are getting much worse. One of our concerns is that we're really not reporting very well or even tracking very well people who acquire COVID-19 at facilities.
Really?
Yeah. Our metric for that is you have to be in the hospital at the time, 14 days. And if you get better and your symptoms disappear, the report doesn't have to be made. And so we're kind of flying blind in that area too. So it is frustrating. Those other organisms and those problems are still around, and people still need to take care to not get those when they get into a facility.
Got a couple of texts and a phone call. Let's take the text first. Can I take a natural blood thinner and get myself off Eliquis? This is my first time with a blood clot. I'm just over 50.
I would definitely consult your doctor before doing that. Natural blood thinners, I would want something that's thoroughly tested by the FDA and directed by your physician, because you can get into severe problems, even life-threatening problems, if the blood thinners are not given correctly in the correct dosage. So the short answer would be no, call your doctor.
This is for Dr. K. I have had 2 doses of Pfizer in March, the immune booster in August. When can or should I get another? He's 70-year-old male.
If he's had the immune booster in August, he's way ahead of the curve as far as what people think you need to have to optimize your immunity. That doesn't mean you're going to be 100% immune or protected with this Delta variant, but you've got your immunity up to the point where it can optimally fight off that infection. At least that's what the hope is. I'm not sure when the next shot will have to be given. It's possible it would have to be given every 6 months. It's also possible that the third shot may be kind of a super booster, or in other words, just get your immunity going so much that it will be long lasting and you won't need one. We just don't know. It's kind of like back last December when people said, well, how long is this vaccine going to last? How long is immunity to the virus going to last? No one knows, because you not only have the factor of the shots and natural immunity going down, but you also have new variants coming around which can escape immunity. And the mu variant, which everybody's so concerned about, there's an article today that it's also in Kentucky. So we're in a lot of trouble right now. We really need to follow public health advice.
Is that mu is the one you're talking about?
Yes, mu.
Yeah. Okay.
MU.
Let's go to the phones. Jim, hello.
Hey, guys. Dr. Kavanagh, hang up and listen. What's your opinion of people packing in 60, 70, 80,000 people to these college and pro football games? Thanks, buddy.
I think it's problematic. If you're within 6 feet of someone, even outdoors, you can get droplet spread of this variant. And as I just stated, we've got another potential variant that's even meaner that may be circulating. All of that is crazy. And one of the things that really disturbed me is that our group was tracking these variants, the Delta variant to be specific, back in May and June. By early June, I think we announced on the Jack Patty show it was going to be a problem. By mid-June, it was up to 21% of the sequencing. So it was really taking hold. And so what do? July 4th, we open up and have celebrations and parties and all but declare that the pandemic's over. So it was crazy. And from there, the Delta variant pandemic took off. And so, yes, I do not think you should be gathering in large groups with this pandemic, even outdoors, because these variants are a lot different than the viruses we were dealing with last year.
Are you concerned as I don't think you mind me saying, older person with some health issues going into the hospital? I mean, does that, it's not in Kentucky, but it doesn't matter. Does that bother you that you might pick up something there that you didn't have going in?
Definitely. I mean, you kind of have to weigh risks. And so let's just state this right now. If I develop COVID in 2 weeks, it's not because I didn't follow my advice. It's because I had to be treated. I don't need to have that all over the nation. Well, don't do it. Dr. Kavanagh said he got COVID. No. All right.
We have Rand Paul scheduled to be on the program on Tuesday morning at 8:50. He has been very, very critical, as you know, Dr. K, of Dr. Fauci, even to the extent of saying that he intentionally lied to the American people. Now, I don't believe that. Do you believe that?
Well, I don't think so. I think it's more a misinterpretation and definition of what gain of function is. Certainly giving any money to the Chinese government for research is something that's not desirable. But overall, they're concerned over, I believe it's under $700,000, maybe even less than that was given over a period of 4 years. And it was a subcontract to a grant that was awarded by NIH. Now, you need to realize that division of NIH has a budget of $2 billion a year. So I'm not sure how much it really means in the whole, realm of possibilities. And it is concerning, shouldn't have been done, but I'm much more concerned if, for example, of all the money that was funded to the WHO by the United States, and the WHO was then funding money to the Chinese lab and doing gain of function research. That was much more problematic. And so it was going on right and left all over the place. And it's a type of research that's very dangerous, should only be done extremely sparingly under very strict conditions. And I think Dr. Paul is right on the ball with the concept of, hey, we need to quit doing this except when it's absolutely needed. And any money going to the Chinese government, no matter how small, is a lapse in protocol and good judgment. So I think Dr. Paul has some points, but I don't think Dr. Fauci is necessarily this evil entity that needs to be removed from office. He made, or at least his division made a mistake, but we just need to move on. We've got much bigger problems to worry about right now.
Okay, we've got a couple of callers on hold, a bunch of texts. Let's do these texts. They've been in for a while. I took the J&J shot in April. 2 weeks later, I started having AFib problems. Now on Eliquis after cardiologist. So should I take the booster?
That you need to really talk to your doctor and find out what the etiology of the AFib is. Rarely, and I mean very rarely, you can get problems from the vaccine, so I can't rule that out. But it could also be something that occurred from something entirely different that came about just after you got the shot. Remember, almost everybody got the shot. Yeah.
Right, so it could have been just a coincidence.
Yeah, just a coincidence.
This is John says, get well soon.
Oh, thank you.
Does Dr. K think the vaccination has caused the variant to take hold and come back with a vengeance? Does it have anything to do with it?
No, I don't, because the Delta variant, that originated in India. The Mu variant originated in Colombia. These are not homegrown variants. But the point of, if we don't all get vaccinated and we spread around the virus, it will mutate and make the vaccines not work. That is a very valid point, because vaccines primarily work by community protection. In other words, it stops the spread of the virus. Otherwise, the virus will eventually mutate and avoid the vaccines, making them not as effective. And we're kind of seeing that now. With the current vaccine, you can get sick, but likely not deathly sick or not dying sick or in the ICU. It still has good protection for that. But we still need to stop community spread.
This is Jim. Thanks for calling, Jim.
Yes, sir. I don't think that any country should be allowed to create anything that's going to kill people. It's kind of like the atomic bomb. What's the point in it? And the other thing is there anything that we can put in humidifiers that might help a person's lungs to, have problems and stuff? Is there anything you can add to a humidifier?
All right, thank you. What do you say, Doc?
Well, I'm not sure about adding to humidifiers. And of course, humidifiers, you've got to be careful, because the water you have in them can sometimes become contaminated and you actually are spreading pathogens rather than trying to make the air better. The best thing to do if you have lung problems, I think, is to get a HEPA filter and have that in your house and make sure that the air is as clean as it can be. The gain of function research, the caller has a very excellent point on that. You've got to be extremely careful. The only study I read that I thought was a good example was the one that's saying, hey, we've got the Delta variant here. How might it mutate? And there was a gain-of-function researcher who said, well, if you just make one mutation, you can make this totally evade the vaccine. Therefore, we need to make the vaccine to that mutation because the Delta variant will eventually acquire that mutation. And so that type of research may have some benefit. In fact, I think it does. But overall, if you just take a virus out of thin air and start playing around with it and try to make it something that could wipe out mankind, which, by the way, they've pretty much have done with some of the viruses, he's right. It's just like fooling around with the atomic bomb. So we've got to be very careful with this. And it's something that I think should be an exception. It shouldn't be funded willy-nilly by a board agency of a NIH or any sort of government institution.
I totally want to keep your privacy. You have said some things indicating that you're going to be having some medical work done on you. So I don't want to be out of school here by saying this, but do you think, and like I say, I truly respect your privacy here, but is there a possibility, since you might go to a hospital or will go to a hospital, that your surgery could be put off because of people, that they won't have a bed for you?
Well, it's always possible, but in general, they tend to weigh risks versus benefits. Right now, they're not in a triage situation, and that's just lucky on my part. I mean, I've had care there for well over a year now, so it's not like anything I said, well, where can I find a bed and jump to another state? And I have a lot of friends and doctor colleagues there that I've known for a long time, which is why I chose that institution. But it is something that could happen. But you need to remember that when you get into triage situations, if it's an acute triage where you've got plenty of facilities, you take care of those that are the sickest first. When you start running out of vents, there may not be a vent for someone who's unvaccinated.
Yeah. Dr. K, good luck to you. We'll talk to you soon, okay?
All right. Thank you.